Welcome to the world of antipsychotics. As future doctors, it's important to understand these medications. Antipsychotics are a class of drugs primarily used to manage psychosis, including delusions, hallucinations, and disorders like schizophrenia. Antipsychotics treat serious mental illnesses. They work by altering the effects of neurotransmitters in the brain, which are chemicals that transmit signals between nerve cells. They help people with conditions like schizophrenia and bipolar disorder. These medications can significantly improve the quality of life for those affected by these conditions. They're powerful, and understanding them is crucial for safe and effective treatment. Knowing the different types of antipsychotics, their mechanisms and potential side effects is essential. Antipsychotics are a cornerstone of modern psychiatry. Over the years, they have evolved from first-generation to second-generation drugs, each with its own benefits and challenges. They have revolutionized the way we treat serious mental illnesses. The development of these medications has been a significant milestone in psychiatric care. By understanding how these medications work, their potential benefits, and their risks, you can make informed decisions in your practice. You'll be well equipped to provide the best possible care for your patients. This knowledge is not just theoretical, but has real-world applications that can make a difference in people's lives. Antipsychotics are divided into two main types, typical and atypical. Typical antipsychotics, also known as first-generation antipsychotics, were discovered first. Examples include haloperidol and chlorpromazine. Atypical antipsychotics or second-generation antipsychotics are newer. They often have a different side effect profile. Examples include risperidone, olanzapine, and quetiapine. It's important to note that each antipsychotic, even within these categories, has a unique profile. They have different strengths, different side effects, and different ways they interact with other medications. Antipsychotics work primarily by interacting with neurotransmitters in the brain. Neurotransmitters are chemical messengers that allow brain cells to communicate with each other. Dopamine is a key neurotransmitter involved in psychosis, a state characterized by hallucinations and delusions. Most antipsychotics block dopamine receptors, particularly the D2 receptor. Atypical antipsychotics often also affect other neurotransmitters such as serotonin and glutamate. This broader action might contribute to their different side effect profiles. Schizophrenia is a chronic mental illness that affects a person's thoughts, feelings, and behaviors. Symptoms include hallucinations, delusions, disorganized thinking, and social withdrawal. Antipsychotics are the cornerstone of schizophrenia treatment. They help manage these symptoms and improve quality of life. Both typical and atypical antipsychotics can be effective in managing schizophrenia. The choice of medication depends on individual patient factors, such as side effect profiles, medical history, and treatment response. Section 5. Using antipsychotics to treat bipolar disorder. Bipolar disorder, formerly known as manic depressive illness, is characterized by extreme shifts in mood. Individuals experience episodes of mania, elevated mood, energy and activity, and depression, which involves low mood, loss of interest, and fatigue. Antipsychotics are often used to manage the manic or mixed episodes in bipolar disorder. Certain atypical antipsychotics, such as quetiapine, are also approved for the treatment of both manic and depressive episodes in bipolar disorder. Section 6. Using antipsychotics to treat major depressive disorder. Major depressive disorder, or MDD, is a common and serious mood disorder that affects how you feel, think, and act. Antipsychotics are not typically the first-line treatment for MDD, but they can be used as an add-on therapy when antidepressants alone are not effective. In these cases, atypical antipsychotics are often preferred. They are typically used in lower doses than when treating schizophrenia or bipolar disorder. Section 7. Side effects of antipsychotics. What to watch out for. While antipsychotics can be incredibly effective, it's essential to be aware of their potential side effects. These medications are often prescribed to manage symptoms of severe mental health conditions, such as schizophrenia and bipolar disorder. However, like all medications, they come with their own set of risks and benefits. Typical antipsychotics, also known as first-generation antipsychotics, are associated with extrapyramidal side effects. These side effects are particularly concerning because they affect the nervous system and can significantly impact a patient's quality of life. These side effects affect movement and include muscle stiffness, tremors, and restlessness. Patients may experience involuntary muscle contractions, making everyday activities challenging. It's crucial for healthcare providers to monitor these symptoms closely. Atypical antipsychotics, or second-generation antipsychotics, are less likely to cause these extrapyramidal side effects, but can increase the risk of metabolic side effects. These newer medications are often preferred because they are generally better tolerated. Metabolic side effects include weight gain, high blood sugar, and high cholesterol. These changes can lead to more severe health issues such as diabetes and cardiovascular disease. Regular monitoring of blood sugar and cholesterol levels is essential for patients on these medications. All antipsychotics can also potentially cause cardiovascular side effects, such as changes in heart rhythm. These changes can be dangerous and may require immediate medical attention. Patients should be aware of symptoms like palpitations or dizziness. Regular monitoring and patient education are crucial for managing these potential side effects. Healthcare providers should work closely with patients to ensure they understand the risks and know how to recognize early signs of side effects. This collaborative approach can help mitigate risks and improve treatment outcomes. Section 8. Why understanding antipsychotics is crucial for doctors. As future doctors, your understanding of antipsychotics is paramount. You will encounter patients with serious mental illnesses who require these medications. Your knowledge will help you make informed treatment decisions, manage potential side effects, and provide compassionate care. Remember, each patient is unique, and treatment should be individualized. By staying informed about the latest research and guidelines, you can ensure your patients receive the most effective and safest care possible. Section 9. Further reading. Exploring the world of antipsychotics. Antipsychotics are a cornerstone in the treatment of various psychiatric disorders, including schizophrenia, bipolar disorder, and severe depression. Understanding these medications is crucial for any medical professional working in mental health. This is just the beginning of your journey into the world of antipsychotics. These medications can be life-changing for patients, but they also come with a range of side effects and considerations that must be carefully managed. To deepen your understanding, I encourage you to explore the following resources. These resources will provide you with a comprehensive overview of the pharmacology, therapeutic uses, and potential side effects of antipsychotic medications. Stahl's Essential Psychopharmacology, Neuroscientific Basis and Practical Applications. This book is a fundamental resource that delves into the mechanisms of action, clinical applications, and side effects of various psychotropic drugs. The American Psychiatric Association, Diagnostic and Statistical Manual of Mental Disorders, or DSM-5. This manual is essential for diagnosing and understanding the criteria for various mental health disorders, which is crucial when prescribing antipsychotics. The Maudsley Prescribing Guidelines in Psychiatry and Up-to-Date Antipsychotic Agents. These guidelines offer evidence-based recommendations for the prescribing and monitoring of antipsychotic medications, ensuring you stay current with best practices. Never stop learning, and always strive to provide the best possible care for your patients. Continuous education and staying updated with the latest research are key to becoming a proficient and compassionate healthcare